MMT, hip internal rotation, gluteus minimus and medius, tensor fasciae lata. Assist the patient to the short sitting position with their feet supported by a stool or on the floor. The trunk may be supported by placing the hands flat or fisted at the sides. Sit on a low stool or kneel slightly in front and to the inside of the leg being tested. Passively move the patient's hip through internal rotation. You are not assessing the infield. You're determining how much range the patient is able to move in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to internally rotate the hip as you observe for any substitutions. Stabilize the patient at the distal femur, just proximal to the knee. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include the following: lifting the ipsilateral buttock off the table, or leaning the trunk in any direction to lift the pelvis, extension of the test knee or hip, and adduction of the test hip. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the distal, medial aspect of the femur with your hand just proximal to the knee. This hand will offer counter pressure in a lateral direction. Place your other hand just above the lateral malleoli of the test leg. This hand will apply the resistance in a medial direction. The two forces are applied in counter directions for this rotary motion. Apply the force for a 5-second count. Grade 5, normal. The hip internally rotated to the available range of motion, and the patient was able to hold the end position against maximal resistance with no break in the position. Grade 4, good. Hip internally rotated to the available range of motion, and the patient was able to hold against strong to moderate resistance. Grade 3, fair. The patient is able to move through all the available range of motion in hip internal rotation, but is unable to tolerate any resistance. If none of these conditions are met, we must reposition the patient into a gravity-eliminated position. Assist the patient into the supine position. Position the test limb in partial external rotation. The gravity-eliminated position of the therapist is to stand on the side of the leg being tested. One hand is used to palpate the gluteus medius over the posterolateral surface of the hip above the greater trochanter. The other hand is used to palpate the tensor fasciae lata on the anterolateral surface of the hip below the anterior superior iliac spine. Observe the hip for any extraneous movements. Ask the patient to internally rotate the leg. Grade 2, poor. The patient completes full range of motion in the supine position. Grade 1, trace. There is partial range of motion, or you are able to palpate a contraction in either or both of the gluteus medius and the tensor fasciae lata. Grade 0, no palpable contraction.